Hello everyone, myself Dr. Amit, and today we're going to discuss about autosclerosis in our learning case presentation. So 29-year-old female came with complaints of ringing sensation with hard of hearing on bilateral sides, more prominent on the right side as compared to the left sides since 3 months. There is a history of ringing sensation right side since 3 months and which was associated with the headache. On examination, bilateral tympanic membrane were intact, and in the pure tone audiogram, the right side was 35 decibel hearing loss, whereas in the left side it is 25 decibel hearing loss, which is minimal, and the right side it is a moderate. Then patient came for HRCT temporal bone, and here we have done the HRCT temporal bone. In this axial representative images, we can see that here we have the oval window, and just here we can see there is the U shape, that is the foot plate of a stapes. Just anterior to the oval window, we can see that here we have the fistula antefenestrum, and we can see that here there is a demineralization plaque noted on the right side of the fistula antefenestrum. Also, we can see that here we have the semicircular canal. This is the apical and this is the medial. And here, just adjacent to the semicircular canals, we can see that there is again one demineralization plaque noted in the retrofenestral region. Now look over here on this left side. Here we can see that here we have the malleus, here we have the incus, and here we have footplate of this stapes. We can see that it's a U shape, and just anterior to this the footplate of the stapes, here we have the fistula antefenestrum, and again in this side also there is a demineralization plaque, and as well as in the retrofenestral region we can see that demineralization plaque just adjacent to the semicircular canals. So in both the side there is a demineralization plaque noted in the fistula antefenestrum and also in the retrofistral region. We can see that this is the normal image, and here in this image we can see that this is the neck of malleus, this is the stapes head, here we have the posterior stapes crux here, and this U-shaped stapes which is attaching here, and just anterior to it here we have the fistula antefenestrum, and we can see that here the normal bony anatomy. Also in the retrofenestral region, as we can see that the fistula antefenestrum on the retro and the posterior side appears normal. Again in this axial cut section at the temporal bone, these are the demineralization plaque noted in the retrofenestral region. So these are the plaque. Here also in the coronal sections, these are the cochlear turns, and here we have the demineralization plaque. Here we have the demineralization plaque. Also again in this next subsequent coronal sections, these two are the demineralization plaque noted in the retrofenestral region. Rest of the middle ear appears normal. Here we have the ice cream cone appearance of the inguinal-malleolar joint. On the both side this joint appears normal. We can see that in the right side it is normal, on the left side it is normal. Okay, here also the middle ear appears normal. Coronal section we can see that the external auditory canal appears normal, and just here in the left side we can see there is a retraction of the tympanic membrane. We can see the mild retraction of the tympanic membrane. Rest all appears normal. So we gave it as a hypotenuse demineralization plaque anterior to the bilateral oval windows in the region of fistula antefenestrum and adjacent to the bilateral apical and middle turns of the cochlea, as we have described already. So we gave likely bilateral fenestral and retrofenestral autosclerosis. So this was our diagnosis. So this autosclerosis, which is also called as otospongiosis, the pathologic appearance of lytic spongy bone foci in bony labyrinth of unknown cause started in the perifenestral region, and it is progresses to the surrounding cochlea. So there are two types, fenestral and the cochlear autosclerosis. We have discussed that the fistula antefenestrum, that is the cleft of fibrocartilaginous tissue between the inner and the middle ear just anterior to the oval window, and in our case which was demineralized. Okay, so here in this line diagram, here we have the fistula antefenestrum, and just posterior to this oval window you can see that here we have the fistula posterior fenestrum. So these two were demineralized. So in imaging features, CT is the most common recommendation for the temporal bone, there is a no role for CCT in the otosclerosis. So in the normal plain CT scan, there are two changes, early and the late changes. In early changes, temporal bone findings are begins as radiolucent focus at oval window anterior to the margin, spread to involve all margins of oval and round windows, may spread to the inner ear otic capsule, and this sign is called as the double ring sign or halo of radiolucency surrounding the cochlea in severe otosclerosis. In the later phases, after the disease progresses, which is going to call as the healing phase, and here there is a hipped up new bone along the oval and the round windows, and also there can be the hilled plaque may occlude oval window and maybe to the round window. Mixed radiolucent dense foci present in bony labyrinth. So the imaging recommendations are temporal bone CT, and we can go for the MRI, but in MRI only T1 contrast weighted images are important, where we can see that the active phase of the otosclerosis, whereas the high resolution T2 MR may miss the otosclerosis. There are differential diagnoses for these conditions are chronic otitis media with tympanosclerosis, temporal bone Paget disease, temporal bone fibrous dysplasia, temporal bone osteoradionecrosis, temporal bone osteogenesis imperfecta. So these are top differential diagnoses for this condition. So here, this is the illustrated findings of fenestral otosclerosis. The donut-shaped otospongiotic plaque, which is surrounding the stapes footplate in the oval window. The crisp margins of the oval window are obscured by plaque. We can see here, okay. And in the coronal right temporal bone CT shows a lytic focus anterior to the oval window, the typical appearance and the location of otospongiotic plaque of fenestral otosclerosis, as we can see here. Then this is another image, and here we can see that this is the graphical representation of this classic example of cochlear otosclerosis, and note that the plaque in hollow around the cochlea. So with the concurrent fenestral otosclerosis in the axial left temporal bone CT scan, which is showing cochlear otosclerosis as osteolytic foci surrounding the cochlea. Concurrent fenestral otosclerosis is noted as bony lucent along the cochlear promontory extending from fistula antefenestrum. So this is all about the otosclerosis, or which is also called as otospongiosis. Thank you for watching this video and stay tuned for the next one.